Candel Therapeutics develops viral immunotherapies for very difficult to treat cancers. So think of pancreatic cancer, non-small cell lung cancer, prostate cancer, and glioblastoma, brain cancer. We have a program with an investigational medicine in glioblastoma. The medicine is called CAN-3110, and it's a second generation oncolytic virus. It's a herpes simplex virus, HSV, that has been designed to replicate specifically in the tumor while sparing the healthy tissue. As you know, HSV does not have a great reputation because it can make you sick. Most people have been exposed to it actually. But here we have engineered this virus in such a way that it will attack the tumor cells while sparing the healthy tissue. We presented data for the first 41 patients with recurrent high-grade glioma, brain cancer. Most of these patients will have glioblastoma. And we published these data in October 2023 in Nature, very high impact scientific journal. And what we found is the following, that first, it was generally safe and well tolerated to inject this into the tumor of patients with recurrent high-grade glioma. So these patients had failed neurosurgical resection, chemotherapy, and radiotherapy. So they run out of options basically. And we injected CAN-3110 just once. So as I said, it was generally well tolerated, but even more importantly, we could show that we could double the expected median overall survival in this very therapy-resistant population. Since the publication in Nature, based on the first 41 patients, so this is not very early days anymore, we've been able to reproduce these findings in another independent cohort of patients with exactly the same findings. The next step is now that we have shown that this is actually feasible and well tolerated, and we believe that we have a potential medicine here with just a single injection. The next question is, could it be even better if you would give multiple injections into the tumor? So we have disclosed at ASCO, at the big oncology meeting during the summer in 2024, that it's feasible to inject up to 6 injections in the same patient. And we demonstrated data for the first 6 patients. So it's feasible. It's actually a procedure in daycare. So the whole procedure takes 45 minutes and the patients can go home the same day. So if you compare that to a neurosurgical resection, actually it's quite patient friendly. But now the next big question is going to be, what does that look like in terms of efficacy and in terms of the biomarker findings? And we expect to present the first activity data in the second half of 2024. Yeah, well, glioblastoma is a very difficult to treat disease with a very poor prognosis. When you think about patients who have just been diagnosed, the expected median overall survival is less than 15 months. We are focused on the population with an even worse prognosis because they have failed surgery, chemotherapy, and radiotherapy. In the population that we are focused on, you expect a median overall survival of less than 6 to 9 months. We have shown doubling of this expected median overall survival, which is, I think, extremely encouraging. We got the scientific validation as shown by the publication in Nature, but also the validation by the regulators. We got fast track designation from the FDA as well as orphan drug designation.